Okay, hi everyone. We're here today with Dr. Saw. She's gonna talk about her life and her journey as a general dentist. If you have any questions, put them in the YouTube live chat as we go through the presentation, and we'll go over them after the presentation is over. Dr. Saw, you have the floor.
Okay, awesome. Well, thanks for having me. My name is Dr. Saw, and I put together a brief presentation about a couple of things that I do. So I'm really glad that you guys are all listening in. Okay, so a little bit about me. So I'm a general dentist. I practice in Carlsbad, California, which is actually located in San Diego County. I am a graduate at Case Western Reserve University in 2010. I graduated with my BA in biology. And in 2014, I got my doctorate, my DDS at Loma Linda University. So just a little bit, I wear a couple hats. So I thought I would talk a little bit about what I do specifically. My main job is being a dentist at Elevated Smiles in Carlsbad, California. I own my own practice, and um, at this place, I do some basic exams and fillings and composites. We do scaling and root planings, which are deep cleanings. We do regular cleanings and prophies. We do crowns. We do all porcelain crowns. We do root canals, extractions, dentures and partials, whitening, and veneers. So, what got me into dentistry? I actually had no intention to go into dentistry whatsoever. But what got me into it was the fact that I just needed a little summer job when I was in college during my freshman year. So somebody at my church was like, "Hey, we're hiring at our office. Can you help us out? It's just to help turn over the rooms." And then at that time, I was like, okay, sure. It's just a little extra money. And um, from there, I was like, oh, dentistry is actually pretty cool. And I got to see what dentists do and shadow, but also like not only do sterilization, but also learn the ins and outs of it. Before going before like going into this job, I actually didn't go to the dentist a lot. Like I had seen like my pediatric dentist, but I wasn't really like going twice a year like I should have. And this job was actually very game changing to where I wanted to go in my life. Okay, so in my job, the reason why I go into dentistry is because I get to do things like this. I get to take smiles from that are completely broken down and build them up to look like this. So believe it or not, this case was actually done in one day. We did something called a CEREC technology, which is same day crowns, and we were able to restore and give him a new smile. And this guy, it was really important he was on a time crunch, and it was important to get a new smile before his daughter's wedding day. A couple of other cases I wanted to show. These are pretty typical in my practice. To be able to fix broken down teeth into something pretty big and beautiful and make people look supernatural. Again, you can see a couple more cases that we've done of some veneers or little chip teeth. A lot of these cases, we do them in just one day. It's amazing. So like I said, we do the CEREC CAD-CAM technology. That's the same day crowns and veneers. This is something that we scan a patient's mouth. The computer is able to help us design a crown, match it to the course to the symmetrical tooth. We also do, that's a little advanced, is that we do some laser therapies in our practice that just helps us reduce bacteria or conservatively remove tissue. So some people may have like tissue that's overgrown over the wisdom teeth, or after a deep clean, they may still have a lot of bacteria or periodontal disease. We'll go ahead and use that laser to reduce the bacteria load. Okay. So that's kind of like the job that I originally got started in. being a dentist. But since then, I've definitely have started, especially when we were closed for a couple of months due to COVID, I started really thinking about what my patients were asking me. I think a lot of patients, I hear this over and over in my practice, is like, Dr. Saw, I love you as a person, but I don't like coming to see you as my dentist. A lot of people in the past, they've had some bad experiences, or they'll say like the Novocaine didn't work. Or they're just very like tired of getting cavities all the time. So during the COVID closure of my practice, I decided to formulate another company, and it's called Oral Genome. So Oral Genome, that's my other job, is that we test people in their saliva for their risk for cavities and gum disease and bad breath. So I'll just show this like little quick video here. But this is pretty much, we send a kit to anybody's house, a consumer's house. Once they unbox it, we have some nice instructions there, but you want to go ahead and spit, you want to rinse with the blue solution and then spit into the cup. And then you put the different solutions, mix them up, and that's our stabilizers, and then you send it to our lab. What this does is we found as dentists that saliva has a lot to do with how you fight cavities and gum disease. So we're measuring 7 factors or 7 biomarkers in your saliva that's going to tell you what you're at risk for. So in my practice, we do salivary testing. We really focus on prevention. What we measure is your acidity, your proteins, your resistance to acid, your red blood cells, your white blood cells, cavity causing bacteria, and bacterial byproduct. Those are biomarkers that going to influence how your saliva responds and fights to dental problems. So we started this in my practice, and because COVID has really brought on a lot more information about saliva, that a lot of physicians and dentists and medical professionals in general are realizing that saliva gives you a wealth of information. So that's what we've been doing at Oral Genome, is we tell this information to a consumer so that they can spend less time at the dentist and make their experiences more positive and go ahead on the prevention. So we're measuring your tooth health, your gum health, your cleanliness. All those 7 biomarkers fit into those categories. Then we're going to go ahead and give you a score for each one of those salivary factors, and then we give you natural recommendations to be able to sway your saliva and rebalance your saliva so you're at a reduced risk for dental problems. Okay, so I just want to do a little fun dental facts. Did you know that there are 3 predominant cavity-causing bacteria in your mouth? So that's Streptococcus mutans, Streptococcus sobrinus, and Lactobacilli. Those 3 have to be in balance, and if they are off balance, they can actually cause harm in your mouth. There are ways to fight cavities, and xylitol and erythritol are actually sugar substitutes that cavity-causing bacteria cannot digest. And also allicin is a property that is in certain foods like garlic, onion, leek, and parsley and asparagus that are antibacterial and help fight cavities. So those are just fun facts and things that I actually go over with my patients during some consultations after we do saliva testing. So a little bit more about saliva and foods. A lot of my things that we do with our coaching with our patients too is there are different products out there, and I put some of my favorite things out there, like cheese. Cheese and nuts are really good because they have a property that fights cavities. Lola's is a product that we carry in our practice. You can also get it online, but they have a type of sugar that helps prevent or cavities and that cavities cannot break down. And then Tom and Jenny's is actually made by one of my colleagues, which um, I absolutely love this product because it is made out of xylitol. It's pretty low calorie. It's if you love caramels, like I can't taste the difference between regular caramels and their caramels, but they are also anti-cavity. So those are like some products that if you guys are interested in trying, like definitely you're getting something good for your teeth. Other fun facts. So, fun dental facts that I tell patients, and I know people can get kind of busy and they say, like, I'll have patients that will say to me, "Oh, I floss daily." I'm like, "Do you really floss daily?" And they're like, "No." But the reason why I can tell they don't floss daily is because we'll see little lesions that are starting between your teeth. And I always tell people, if you don't floss, you're missing up to 40% of your teeth. And that's a lot. So um, I encourage flossing daily to help us prevent cavities. If people do get cavities between their teeth, we have to do something called a class 2 composite, which we go from the top and go in between, and then we put a band around it, and then we'll go ahead and fill the white material to restore the tooth. The other fun fact, dental fact I wanted to put out there is chewing sugar-free gum helps reduce your risk of cavities. My favorite gum product out there is, I would say, like the ice cubes, because that's also xylitol based. You can pretty much get them at any grocery store, but those are any sugar-free gum, especially one that is recommended or has that ADA seal, like acceptance on the back of it, is really good for reducing your risk of cavities. pH is also really important. That's actually one of the things that we measure in Oral Genome. The Oral Genome Kit is how acidic your saliva is. So the more acidic your saliva is, the more you're at risk for tooth breakdown and tooth decay. So acidic saliva is anywhere a pH from 1 to 6. A neutral saliva is a pH of 7, and a basic saliva is 8 to 14. Acidity and pH is probably one of the key factors that is really important. But one of the other things that is super important is how your saliva fights that. And we measure that by something called buffering capacity. So how your saliva buffers the acidity and fights that acidity so it prevents that tooth breakdown. Everyone is a little bit different. I was actually surprised with my results myself. But yeah, so like I said, pH is really, really important, and what you eat has to do with that. Just fun question out there. Does anyone know the pH of Listerine? It's like one of the most common mouthwashes that are out there. I feel like everybody buys it out there, but does anybody know the pH of Listerine? Okay. It's actually 4.2. So it is a little bit on the acidic side. We'll have another fun question right now. Does anyone know the pH of milk? So the pH of milk is 6.7 to 6.9. So that's okay, but I mean, it's going more towards the basic side, but it's crazy how Listerine is actually on the lower pH side. One of the things I tell my patients, and a lot of people don't realize, is that there's a lot of connection between your systemic health and your oral health. So did you know that gum disease, and especially like with gum disease, like I tell people, like pregnant moms, like make sure you're brushing and flossing really well. I know sometimes it can be very nauseous to like I've been pregnant myself. It's really hard to brush your teeth because of all the hormones, and like you're very sensitive. But things like that, like get your periodontal disease treated, because there's associations with low birth weight or premature delivery. There's also like a lot of dental connections between your oral health and like your cardiovascular health, diabetes, stroke. There's tons and tons of things. And your oral health, like your mouth, is like that entryway for bacteria to go in. So as dentists, our role is super super important, because when someone has an unhealthy mouth, there's usually systemic things that may be going on. So it's we always encourage people like get their treatment done or go on the prevention side, because especially with COVID going on, people who have a lot of inflammation in their gums are like 9 times more likely to have complications from COVID. So it's very important. Yeah, so like I said, studies have shown that COVID-19 patients with gum disease are 9 times more likely to die. That's like a crazy number, but that just goes to show how important your gum health is and your dental health is to your overall health. uh, COVID has really just opened up some doors that 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 a lot of people were not even aware of, or it was like studies were there, but now people are just more like it's on people's minds, like, oh wow, dental health has to do a lot with your overall health. Um, my other job is when you become a dental student or a dentist, you start wearing these magnifying glasses. So I love um, I love helping other dentists be able to see better. So when we do preparations, we wear these like big goggles that we can see, and it's like these magnifying glasses inside on our eyes with lights that shine, because the mouth can be super dark. So that's just a quick side note. That's my other job that I do. Um, but going back to like more clinical stuff, I definitely find dentistry to be super fun. So this is actually a case I did. This is actually of a homeless guy. He was a homeless guy in San Diego, and he only had a couple teeth. And from then we were able to, and those couple teeth, they were infected. And when he came into my office, he said, I was like, "Oh, how are you functioning on those teeth?" He said, "I'm just living day by day by whatever antibiotics I can get." Um, so we were very fortunate to be able to film this case and its process with CBS, and we took out all his infected teeth, let his bone heal up, and then we got him a new dentures and a new set of smile. You can actually, we just aired this episode about 2 weeks ago, but if you guys want to check it out, just look up CBS homeless man in Ocean Beach, new smile. You can see that like dramatic transformation. Yeah. So that's actually part of why I go into dentistry. Is it is a very rewarding profession. Like you go in at the end of the day going, "Oh my gosh, like I can't believe like I did something that changed someone's life, or like change how other people see him." So on the final day of his delivery of his dentures, he said to me something that just really heartwarming. It's like, people used to run away from me, and now they don't, because I don't look scary. Like people are more willing to approach me. So a smile is everything. But moments like this and is kind of why I chose to go into dentistry. It's just so that we've done a lot of things that actually impact people's lives, and they thank you forever for it, and like you make that big change for them. So anyways, I highly encourage you guys to look it up online. CBS did a really great job just documenting his story. So dentistry is fun, like our saliva testing with oral genome. we're predicting your risk for dental problems and how you can prevent that. I had the privilege to also be on Fox 5 to talk about that. I've also been able to talk on Shape magazine and be part of their article about canker sores. And there's a couple other things that I can't really say, but we have aired that should be airing pretty soon. But anyway, dentistry is a very artistic profession. Not only do you help people, but you get to like create these smiles. Like I have a patient that tells me like, oh, I want my teeth to be a little bit more rounded or a little bit longer. I want this color. I want this type of gradation. I get things like I have like a man that I saw last week. He's like, I want gold grills. Like you got to do fun things like this. So that's another aspect of dentistry of why I love what I do. This is actually a photo of me customizing a posterior crown. It's a premolar. When I colorize my crowns, I'll go ahead and glaze it. But a lot of times I'll put like little brown spots on there, like in the grooves of the teeth, just to make it look and give it an extra dimension. So my office, I actually have a lot of pre-dental students that work for me. They're all college kids, and I love mentoring. It's partly because that's how I got into dentistry, is because I worked for a dentist in college, and I didn't realize how great of a profession was until I got there. But for all the pre-dental students out there, I always tell them, make sure you shadow a dentist. I can't tell you how many students have come to my office and they've shadowed, and that's when they realize that they can't deal with blood. So really just go in and see, is this something that you can do? Is this something that is actually like pretty cool? And don't just shadow them for one day. Shadow like a couple other dentists, like shadow them for like a week or something. Just really get to know like what the profession is. The other thing is be persistent. Being persistent is important because I know especially now it's hard to get like a shadowing position because of COVID, but just always check in with like different dentists around town, or check in, whatever you want to do to advance your career or like to explore dentistry. Just like don't be afraid to ask people, like other people, like, hey, can I like come hang out with you for the day, or can I email you some questions, or can we jump on a call? So that's kind of what I did, just to make sure I knew this is what I wanted to do. My other advice is work hard and play hard. Study hard, and then, but I used to like study, like, okay, I'm going to study for like 1 hour and then I'm going to take a 20-minute break. So, or I'm going to like I'm going to like study the entire day and then I'll go out to eat. So work hard and play hard, but also have that balance. That's like another thing that I advise pre-dental students. The other thing is do you, because there's a lot of ways that you can get into dental school. You don't have to be like a 4.0 GPA student, work at a dental office, do research, or be a biology major. There's so many different pathways to go. I know dental schools are always looking for someone unique and has that personality and has that persistence and drive. However you want to do it, just be you, be genuine. I don't know how to explain it, but there's no right or wrong way to go into dentistry, and there's no exact path. So that's just one of the questions I get all the time, is like, well, how do you do it? Like, am I supposed to do this? I'm like, what is it? It's different for everybody. The other thing is let your personality shine. Just being genuine and showing compassion. That's going to really help you get into dental school. Okay. Does anyone have any questions so far? I know I've been doing a lot of talking.
I had a couple questions. So,
Yeah.
how did you think of creating Oral Genome?
Yeah, so that's a really good question. So there's a couple things in my office that I would get all the time. Like, how come Like my twin, I'll get this. This is like a typical one. My dad has really good teeth. But my mom, I got her genes. Like my mom always has bad teeth. My grandma has bad teeth. And so oral genome was something to help answer those questions. And because as dentists, dentists can only see cavities that have already formed when it's too late. And then at that point, we say you need to get a filling or a crown or a root canal or extraction. Nobody wants to go through that. So that's how I was like, okay, there's other ways. And I went back to dental school and thinking, one of the things you learn in dental school is CAMBRA, caries prevention, cavity prevention. But a lot of it has to do with your saliva. So the dentist, they can see what's happened, but oral genome sees what's below the gum line, what has not, what is triggering those things to happen. So it was really just from all the patients that had come to my practice and they seemed a little frustrated that they had another cavity, or they thought like, oh, things are unfair because like my brother has really good teeth, but he has bad oral hygiene, and I have good oral hygiene, but I always get cavities. So it's just answering those questions to help rebalance your saliva.
Thank you for answering my question. Another question is, if you hadn't become a dentist, what would you have done?
Oh my gosh, that's hilarious. So I actually wanted to be an interior designer for like the longest time. Um, so that was where when I was in college, I was like, I actually went to music school, and then I wanted to study to be interior designer. And then um, and then I just once I started working for that dentist in college, I just like started feeling like, oh my gosh, this is where I'm supposed to be. It just clicked. Like this is what I want to do. I still love like designing, and I get some of that actually in dentistry with the artistry of it. And then also like if you go to my office, it's a little bit unique. We have like I'll show you like those plants all over the wall. um and it just looks very like modern and chic, and we have like all these glass doors, and it's so cool because it's not like that typical dental office. It's very spa like. And we had actually funny thing is people are like, who designed your office? I'm like, me. Because we'll have a lot of people that will want to like dentists who are building out their office, they'll want to like come and tour. And my husband's like, we need to have people stop copying our idea. But anyway, I did want to go into interior design for a really long time. And the other job that I thought would be really cool was being a newscaster.
Um, how did COVID affect your typical day as a dentist?
Yeah, so COVID has been a pretty large effect for me as a dentist, because we can only see a certain number of patients a day due to the social distancing. Um, so I would say we're seeing maybe like 70%, like 70% of what we had been seeing before. And then we're just making sure we really stagger appointments. The nice thing about my office is that um, we're not an open bay. We have separate rooms, so it's a little bit easier to do all of that to separate everyone. The other thing is that because of what the American Dental Association says, we ask them those like typical questions. We check their temperature. Um, those are things. So we've just had to just add a couple of other things and extra sterilization and and filters, UV sterilizers all over the office just to help reduce because we work in aerosols.
Um, I think this is our last question. What kind of procedures do you typically deal with?
What kind of procedures I typically deal with. So we have two dentists in practice. I actually practice with my husband. So my husband does a lot of the oral surgery and he places the implants. For me, I do a lot of like the general dentistry, like the crowns and fillings, and anybody who wants to do anything cosmetic, like such as the veneers. So that's we're just a bread and butter type of practice. We do work with a couple of specialists that we refer out. So a lot of our root canals, we'll go ahead and refer those out. We do a couple in our office, but most of them will refer out. We'll refer some implants out, and then also like gum surgeries, we refer that all out.
Okay, thank you. I think that
Yeah. Yeah. So anyway, that's kind of just like in a nutshell, really quick about the things that I do. If you guys, I know I talked quite extensively about saliva testing and how important it is. If you guys want to test your saliva and know um, what the 7 biomarkers and how they are, like your scores, like I'm definitely I'd be happy to I'm running a limited time special just for you guys to do that. And our kits are normally $165. They are $49 for anybody listening to this presentation. The code is dental HS. So if you enter that, you'll get that one-time special to understand your saliva. Um, we will send you a customized report. Let me see if I put that up there. Yeah. So we'll send you a customized report through email that's HIPAA compliant, and it'll tell you the scores on what you measured. And then we'll go over some of the recommendations that we have so that you can reduce your risk for dental problems. Anyway, so that's just like my small little plug there if you guys want to do that. But that's really it. I mean, you can follow me on Instagram at Dr. Tina Saw. You can, if you have any questions, you can email me. I put my email in there. Anything like if you have a dental question or if you want to just like learn more about my practice or oral genome, I'd be happy to answer any questions. I do. I just started a YouTube channel too. I'm gonna put a little bit more videos about cavity prevention and gum disease prevention, and probably like about. I have a lot of fun things planned there. So if you can subscribe to my channel, you'll get all the updates on all the happenings.
definitely.
Okay. Any other questions?
I think that's all. Thank you so much for presenting with us today. It was an amazing presentation. I loved hearing
Yeah.
about the genome. It was amazing. Thank you so much.
Yeah. Well, thank you so much for the invitation. I really appreciate it. Yeah, you guys have a wonderful rest of your day.